Hello everyone, welcome to MedDevice. In this video, we will look at some of the previous year questions that were asked in the subject of pediatrics. So let's start with the first question. Which of the following is not a characteristic of cerebral palsy? Developmental delay, microcephaly, ataxia, or flaccid paralysis? So I suggest that you pause the video and you try to answer first. And if you answered correctly, great. If not, we will be looking at the main points of the disease. So don't worry, you'll get to know about the disease in brief. Okay, so what is cerebral palsy? So it is a neurological disorder where there is damage to the brain and it primarily affects the muscle movement and coordination. So the patient will have stiffness, involuntary movements, and difficulty in coordination. And another important MCQ that they can ask is that it is the most common chronic motor disability in childhood. So important point. Now what are the symptoms seen here? So these include developmental delay, and in fact this is the most common symptom seen here. We also have abnormal posture and gait, increased tone and reflex. So remember that in most cases the tone and reflexes will be increased and not decreased. Intellectual disability is seen as well as microcephaly, and both of these were given in the options. Seizures and also difficulty in speech and language. So as I highlighted before, the tone and reflexes are increased, and I've also added references to most of the questions here. So if you have any doubt, you can either ask me or you can go directly to the source. So now if we will go back to the question, developmental delay, yes, this was seen, the most common symptom. Microcephaly also was seen. Ataxia is a characteristic feature of this. But flaccid paralysis, no, this is not seen. So this is our correct option here. Next question. Which of the following symptoms is typically absent in a child diagnosed with CF or cystic fibrosis? Sweat chloride test showing chloride concentration of 70 milliequivalent per liter, increase immunoreactive trypsinogen level, hyperkalemia, or contraction alkalosis. So I've made a whole video on cystic fibrosis and I highly recommend that you go and check that out. Here we'll just see the main points. So cystic fibrosis is a genetic disorder where the CFTR gene and protein is impaired, and it mainly affects the lungs and digestive system because of production of thick and sticky mucus. So what is this CFTR protein? So in the membrane we have different type of proteins. Say this one is the CFTR. It has a lot of functions. Some of them include transportation of bicarbonate, chloride and water. Now in cystic fibrosis, this CFTR protein is not working. So this is why we have the symptoms. As you can see, the water will not pass through, and so it will lead to production of sticky and very thick mucus. This can block a lot of ducts in the GIT and also cause problems in the respiratory pathway. So it can lead to symptoms like chronic cough, frequent lung infections, and because of that, difficulty in breathing, poor growth, and of course, digestive problems. We also see issues in the pancreas due to blockage of the duct. If the duct is blocked, it can lead to chronic malabsorption, fat soluble vitamin insufficiency, and importantly, an increase in the serum immunoreactive trypsinogen. And remember, this was in our options. Now, what else? So, this can be diagnosed with the help of sweat chloride test. So, in this disease, there is an increase in the chloride levels in the sweat. This can actually lead to what is called as salty baby syndrome. Now, if we will measure the chloride in the sweat, we will find out that it is more than 70 milliequivalents per liter. And this is how we can diagnose this. We also see contraction alkalosis due to a reduction in blood volume caused by fluid and electrolyte losses. So if we will go back to our options, hyperkalemia was not mentioned, so here our correct option is option C. Now, the likely diagnosis for a 9-year-old boy presenting with knee joint swelling, non-blanching rashes, hematuria and proteinuria is SLE, Henoch-Schönlein purpura, immune thrombocytopenic purpura, or polyarteritis nodosa. So the correct answer to this question is Henoch-Schönlein purpura. So this is actually the most common vasculitis of childhood. Again, an important point that they can ask. And it is characterized by leukocytoclastic vasculitis and very importantly IgA deposition in the small vessels in the skin, joints, GIT, and kidney. So you can see that this IgA deposition is taking place in so many parts, which is why you're going to have a lot of symptoms. But a very characteristic feature of this is its rash. So these are palpable purpura and these are non-blanching. And these are usually seen in gravity dependent areas like the extremities or the pressure points like buttocks. Now, as I said, there are going to be a lot of symptoms. So it can include the musculoskeletal system leading to arthritis and arthralgia. So non-blanching palpable purpura and arthritis was mentioned in our question. Next, it can involve the GIT leading to abdominal pain, vomiting, diarrhea, and paralytic ileus. Very importantly, it can lead to microscopic hematuria, proteinuria, hypertension, frank nephritis, and nephrotic syndrome. And it can also affect the CNS, leading to cerebral hemorrhage, seizures, headaches, and behavioral changes. You can see that all of the symptoms that are mentioned in the question points towards one thing, which is Henoch-Schönlein purpura. Next question. The most prevalent presentation of congenital toxoplasmosis is hydrocephalus, chorioretinitis, hepatosplenomegaly, or thrombocytopenia. So let's see in short what is toxoplasmosis. So it is a disease caused by Toxoplasma gondii and it is usually acquired through contaminated food, water, or undercooked meat, or also by having a contact with contaminated cat feces. Everyone seems to remember the infected cat feces part, but equally important to remember is the undercooked meat. Don't forget this point. Now, this can also be transmitted from the mother to the unborn baby during pregnancy, which can lead to birth defects and miscarriage. So, when a woman is pregnant, it is very important to be careful when a cat is around her. Now, let's see a little about congenital toxoplasmosis. So, chorioretinitis is the most common symptom that we see. So, this is our answer, but let's see other symptoms as well. So, there can be anemia, convulsions, very important intracranial calcifications are also seen, jaundice and hydrocephalus also. So coming back to our question, the most common symptom seen is chorioretinitis. Next, the molecular defect responsible for liver disease in Dubben-Johnson syndrome is ATP7A, ATP7B, ABCC2 or ABCC1. So I've made a table for you highlighting some of the important gene and protein defects that you should know. I suggest that you take a screenshot of this and just try to revise it every day. And if you'll do so, you'll remember the whole table in about 2 or 3 days. So here you can see that in Dubben-Johnson syndrome, the gene that is defective is ABCC2 and the protein that is affected is MRP2. I've also already made videos on Dubben-Johnson syndrome and Wilson's disease also, so make sure to go and check those out too. So coming back to our question, our correct option here is ABCC2. Next, the commonest indication for liver transplantation in children is Allerg syndrome, biliary atresia, Caroli disease, or hepatocellular carcinoma. So the correct answer to this is biliary atresia. And I'll quote a direct line from Nelson's Pediatrics book. Biliary atresia is the most common indication for liver transplantation in children, followed by metabolic and inborn disorders, autoimmune and familial cholestatic disorders, and acute hepatic necrosis. So going back, our correct option is option B. Next, most common heart defect in congenital rubella syndrome is atrial septal defect, ventricular septal defect, patent ductus arteriosus, or pulmonary stenosis. So there is a triad seen in congenital rubella syndrome where the heart, eyes, and ears are affected. If the eye is affected, it leads to retinopathy, cataract, and glaucoma. If the ear is affected, it can lead to sensory neural deafness. And if the heart is affected, it can lead to patent ductus arteriosus and pulmonary stenosis. So again, I have a very important table here that you need to remember and feel free to take a screenshot of this. So here we can see the important syndromes and the important congenital heart diseases that are associated with these syndromes. So here in congenital rubella syndrome, the most common heart defect that you see is patent ductus arteriosus or PDA. So if we will go back, here our correct option is option C or PDA. Now our final question, Which of the following options describes a chest X-ray image? Egg on string appearance, core and sabot, scimitar sign, or snowman sign? So in this X-ray, what we actually see is boot-shaped heart. So if I will do like this, I think it will help you visualize better. So this is seen in tetralogy of Fallot, and its other name is core and sabot. So if you will go back, our correct option here is option B, core and sabot. That's it for this video. If you have any doubts, feel free to message on Instagram anytime or leave them down below in the comments. I'll be more than happy to answer them. Thank you.